Welcome to Time for Health. I'm your host, Rachel Faw, and we're very glad you've joined us. We always like to share a little bit of health information with everybody, whether it's useful for you or somebody you know and love, feel free to pass it on. But I always tell everybody, before you make any changes to anything, you're always going to want to run things by your primary care provider. But today we are talking about palliative care, and I have nurse practitioner Nick Hall with me. Thank you.
Yeah, thank
and
you
you're with Stein Hospice.
Yep, Stein Palliative Care and Hospice.
Okay, awesome. So thanks for being here.
Yeah,
I feel like palliative care is new-ish, I'm sure, in the world of hospice and palliative care. It is not super new, but
Sure.
a little bit new to the mainstream. So what is it, I guess? Just give us kind of a definition.
Yeah, sure. So palliative care has been around for a while, but it's becoming more popular nowadays, kind of moving out into the community more. So basically, it's an interdisciplinary or kind of team approach of healthcare, caregiving for those with severe illnesses,
Okay.
life-threatening, or not so much life-threatening, but terminal illnesses.
Okay.
And the goal is to help mitigate or treat symptoms and help not in suffering, but treat some suffering.
Gotcha. So kind of manage pain and
Yeah, a lot of
all that
symptom
kind of
management, yes.
stuff. Okay. And how is it the same as or different than hospice?
Sure. So hospice focuses on end-of-life care. Typically, for hospice qualification, you have to have a terminal diagnosis with a life expectancy of 6 months or less.
Okay.
Palliative care, you can still have a terminal diagnosis and have a terminal disease, but you're still seeking aggressive treatments.
Okay.
So a good example is like cancer treatment, and you're still having aggressive treatment like chemotherapy, radiation, that sort of thing. And that's kind of where palliative care comes into play. We kind of help treat those symptoms that may arise related to that diagnosis or from the treatments
Or
themselves.
even from the treatment, yeah.
Yeah.
Okay.
So another part of palliative care is it's kind of a stepping stone to hospice. We kind of open that door, but it's I kind of like to say it's the step before hospice care.
Okay. It kind of reminds me of, so there's diabetes, but now there's pre-diabetes. So it's kind of like as we do more research and we understand things more, to catch things a little earlier, including symptom management and pain control, is kind of a legitimate field in and of itself, kind of.
Sure, yeah. The one of the big things, like I said, is symptom management. But another big part of palliative care is goals of care discussion, which really entails what do you want to happen as your disease progresses. So we discuss things like living wills, powers of attorney for healthcare, kind of help getting those things set up, and even having discussions around resuscitative status. Do you want to have everything done for you, or would you rather, if your heart stops beating or you stop breathing, not go through CPR or be on a ventilator, that sort of thing.
Gotcha. Okay. So it's like you said in the beginning, it's interdisciplinary, or there's a bunch of people on the team and that kind of stuff. Does it happen at home or in a hospital or in a hospice facility?
Sure.
All of the above?
Yeah, kind of all of the above. So the palliative program through Stein is pretty much home-based, but we do go to assisted livings, nursing facilities.
Okay.
We don't generally follow our patients in the hospital. If they're in the hospital and they need to see a palliative care provider, especially like at Firelands, you may see a palliative care physician, but if our patients go to the hospital, we will see them once they get back home.
Okay.
So.
And so again, these people may have a terminal illness, but they're still seeking kind of curative treatment or like chemotherapy, like you said, for cancer or other things, that they're still having tests done or surgeries or different things like that.
Right.
Okay.
Yep.
But it can be done basically anywhere.
Pretty
or
much.
if they're in the hospital, maybe paused for a bit and then picked back up when they get back home.
Right. As far as our program goes, we're mostly focused on home assisted living nursing facility. But like I said, you may see a physician, palliative care physician, especially like at Firelands, as needed.
And they're in the hospital. So you talked a little bit about it's symptom management, so I'm sure there's nurses involved, and you talked about advanced directives and all that kind of stuff, so probably social workers. So what other kinds of things are involved?
So our team approach is kind of three-tiered. So we have nurse practitioners that make visits with patients, and it usually varies in duration of between visits, somewhere between 4, 6, or 8 weeks. Now that can be more frequent as needed. It just depends on what's going on with the patient. And then we have social workers that we can get involved to help with things like advanced directives, but they also help facilitate family members finding caregivers if they need help with caregivers and that sort of thing in the home. And then we also have trained volunteers that will call our patients in between our nurse practitioner visits just to kind of check in.
That's nice.
And see if there's anything that's going on and if they need anything.
So just a little phone call to visit, or
nice. just to touch base. Another difference between hospice and palliative care is with hospice care, a lot of times supplies and medications and things like that are covered with the program. In palliative care, that's not so much the case. Those things still go through insurance and that sort of thing. And we don't have nurses besides the nurse practitioners in the palliative program. So
so that was going to be one of my questions too, was the cost. So I know that hospice proper is kind of covered up by Medicare. And some things in palliative are covered by Medicare, but some things would be run through a secondary insurance or different things like that?
Sure. So palliative care services is covered under Medicare, but there may be a 20% copay of the billed amount. And if you do have a secondary insurance, then that covers that copay generally, or it takes it down to a smaller amount. It's very similar to going to like a doctor's office or a specialist office and having a copay.
That makes sense. Who determines if palliative care is appropriate?
Well, a lot of times we'll get a referral from the primary care physician or the specialist like the oncologist. And typically, most of the time, anything that they refer is appropriate. But you have to have a serious illness, a serious long-going illness, such as like COPD, dementia, heart failure, or cancer, that sort of thing. So that's generally what qualifies people for palliative services.
And if somebody called you themselves and said, I feel like my family member's appropriate, you would just connect with the primary care provider and get the order or whatever is needed, that kind of stuff?
Yep. So we'll reach out and we'll just kind of get some information from them just to make sure that we do think it's something that we can help with.
Very cool. And the primary care provider, the family doctor, they're still involved, I'm sure. You tie them in.
Absolutely. They're still involved. So we still encourage our patients to go see their primary care providers and their specialists, whoever they need to see. And then the way our program works is they kind of get a letter from us that says, your patient has decided to be part of the palliative program. What would you like for our nurse practitioners to do to help you care for your patient? So they kind of have given two options: just see our patient, kind of assess and see what's going on, they offer us recommendations, or see our patients, assess the patients, and we're okay with you helping to treat symptoms that come up. There are some exceptions to that as far as like some different controlled substances and things like that, because we see the patients in the home. But that's pretty much how that works.
So they're still involved?
Still very involved, We'll call them if we need something urgently. Otherwise, they get our visit notes and things like that.
So they're kept up to date. And I appreciate you kind of mentioning some of the other diagnoses, because I think a lot of times people think of cancer, but COPD, dementia, heart disease, those are chronic. Some, can be life-threatening or terminal illnesses. I'm not sure the exact wording, but
that's right.
Over time, those need the same symptom management and pain control kinds of things that palliative offers.
Yeah, absolutely. And that's kind of one of our goals, is to help keep people out of the hospital as much as possible. Typically, people see their family provider, their healthcare provider every 3 to 6 months, just depending on what's going on. But we're seeing them a little bit more frequently than that to help keep everybody up to date and keep an eye on them.
And manage those symptoms so they don't get out of control.
Try to keep them out of the hospital if we can.
Very cool. Any last minute thoughts before we depart here?
I don't think so. I'll tell you that our program has rapidly grown. I started in April and we had around 20-some patients, and we're over 90 now. So
I think as the word's getting out about how this is available prior to maybe a 6-month life expectancy kind of a thing. I think that's a really valuable service. So.
Oh, absolutely. I agree.
Awesome. Thank you.
Well, thank you. It's nice to talk to you.
Absolutely. All right, we're done. So that's a little bit of information about palliative care. And I asked my friends at Stein, and Nick came along. I'm sure there are other hospices and other programs maybe that have palliative services as well. So wherever you live, whatever you're looking for, that's an option out there. Palliative care is an option. So again, share that information. And until we meet again, I encourage you to make time for health.